My presentation is on autism awareness. So Andrea talked about what is autism, the cause mainly of autism, the characteristics. So I will be talking about the diagnosis, so the signs and symptoms, warning signs to look out for. I'll be mentioning the sports interventions and the next steps that you should know when working with an individual with autism. So one of the most important things you can do as a parent and caregiver is to learn the early warning signs and the developmental milestones. So the signs of autism tend to emerge between 2 and 3 years of age. So the developmental milestones to look out for are no big smiles by 6 months and no babbling usually by 12 months. So there's usually no words by 16 months. And there's no back and forth gesture, so this could be like no pointing or no waving. And there's no 2-word phrases by 24 months. So this could be such as like, come here. So children with autism may display some of the following signs. So this could be such as inappropriate playing with toys. So you could be like lining up toys, or they could just be moving the car back and forth. So they're not actually playing with them, they're just doing a repetitive motion with the car. Or it could be such as inability to relate to others while playing. So they're taking part in parallel play. They could be sitting on the carpet. They're both playing with trains, but they're not actually playing with each other. So their difficulty dealing in a change in routine. So a lot of the time, children with autism become very anxious when a change in routine occurs. So we need to develop structure in their life. They have a lack of awareness of danger. So for instance, they could walk up to a strange, unfamiliar dog and not aware that that dog could potentially hurt them by biting them. They have sometimes usually sensitive to sound. And they have poor speech or a lack of speech, so no words sometimes. And they have difficulty expressing what they want or need. So say for instance, if they want juice, so they don't have the words to express that they want juice, so it could lead to some form of problem behaviors. And a little or no eye contact. So when you're having a conversation with them, they will not make eye contact with you, most likely. So some concerns to be familiar with for children with autism or individuals is they have eating problems, and they're called picky eaters. But a lot of the times they have what's called gastrointestinal disorders, which could be the underlying cause of their pickiness. They have seizure disorders a lot of times, so 1/3 of individuals of ASD have epilepsy, which results in seizure disorders. They have sleep dysfunction and sensory processing problems, and pica, which is they're ingesting non-food items such as Play-Doh. So something to look out for because it could be really toxic and harmful for them. Self-injurious behavior is another concern, so hitting, scratching themselves. So next steps to take. So these are tips that you can be aware of when working and interacting with individuals with autism. So you want to avoid the use of sarcasm. So say for instance if the child knocks over your papers on your desk and you say great, they're going to take that literally and they're most likely going to repeat the behavior. So you do not use idioms such as put your thinking caps on or zipper up your lips. They're not going to understand what this meaning means, and they're going to be very confused. So you want to keep language and instructions simple and to the point. Say for instance, you don't want to say something like, "It's a beautiful day, put your pencils down and go line up at the door." You want to keep it simple and to the point, so say something like, "Line up at the door." You want to give fewer choices. So the more choices can lead to more confusion for the child. So when the child is asked to pick a color, provide them with 2 or 3 choices instead of 8 or 10 choices at once. So do not ask open-ended questions. So this could be like, "So what do you want to do?" Give them choice in what they want to do by saying, "Do you want to color or do you want to play with the blocks?" Provide very clear structure and set daily routines. So children with autism need structure. So when they have structure in their daily routine, it'll alleviate anxiety. Utilize the use of visuals when possible. So children with autism are visual learners, just like some of us are visual learners. So we want to utilize the use of visuals when we can. So we can use a visual schedule. Can be used to put some structure in their daily routine. So we could, this says, hang up their coat, look at a book, math class, recess, lunch is an example of a visual schedule that could be used. We want to break down small, complex tasks into smaller, more teachable components. So such as brushing your teeth, we could say, take out your turn on the water, wet your toothbrush, put the toothpaste on your toothbrush. So we're breaking down a more like a complex task into more teachable components. We want to minimize distractions, prevent for overstimulation. So this could be, we want to remove sounds, or if there's a colorful wall, we want to remove that to allow the child to focus on the task at hand. So supports and interventions. So supports will need to be put in place for the child from childhood to adulthood to assist in the development of living an independent life as possible. So lasting long-term effects have shown that individuals who start receiving supports into preschool have received the lasting long-term effects. These supports could include things like behavior supports, academic support, social skills supports, and even communication and language supports. So when the child transitions in adulthood, they're still going to need supports, but a different kind of supports. So these supports could include things like supports for education and beyond high school. So this would be like academic supports again. Living arrangements, so group homes it could be living in, job training, employment opportunities, and healthcare. So these need to be addressed in advance to avoid a crisis situation in which the parents become ill or die suddenly and they're not able to take care of their child. So this month is Autism Awareness Month, and I'm wearing blue in support of Autism Awareness. Autism Awareness Day is April 2nd, and this year we celebrated the 8th anniversary. Every year, autism organizations come from around the world to celebrate and raise money with a variety of fundraisers. So Andrea and I did our part to raise awareness of autism. We made a little video called the Whisper Challenge. So you can feel free to check that out on YouTube, or there's a link at the end of our PowerPoint presentation that you can bring you directly to the YouTube clip. What I want people to know is I want people to focus on the individual's strengths rather than the limitations. Everyone has challenges that they need to overcome, and individuals with autism, they just do it in a different way. Autism is an ability, not a disability. Thank you for watching my presentation.